Actions speak louder than words. And today, while we're talking about making children healthier, there's a way you can make it happen. The Royal Children's Hospital Foundation supports research, education and expertise that impacts generations of children. And with generous support from the Good Friday Appeal, together they make this podcast possible. Every single dollar is an investment in healthy children. Search the Royal Children's Hospital Foundation to show your support. Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital, Melbourne, and your host today on the Kids Health Info podcast. In this episode, we're going to be talking about anxiety and how to know if these worries are really a problem for your child and where and how to get help. And to join us for that conversation, we have one of our psychologists, Dr Grace McMahon. Thanks for joining us, Grace.
Thanks for having me.
From the Royal Children's Hospital, Melbourne, this is the Kids Health Info podcast.
I'm really looking forward to this chat today. Anxiety is, so common, it seems, among kids and teenagers these days. Can you tell us a bit about, what it actually is?
Anxiety is the fear or worry that something bad is going to happen, and that children might worry that they're not able to cope when they might be going into a potentially challenging or difficult situation. I guess it's really important to know that anxiety is a normal and natural emotion. All kids experience it. We as adults experience it too. And it can actually be a really helpful emotion in certain situations. So it does function to try to alert us to potential threats or dangers, but what we know about anxiety is that sometimes that threat system goes off when it actually doesn't need to.
So that really brings up that idea of how is it different to have anxiety, or I guess an anxiety disorder or a problem with anxiety compared to regular worries in kids?
Yeah. So I guess, all kids do experience different worries from time to time, and at different stages of their childhood there are worries that are more common. But I guess when we're thinking about anxiety and when it's becoming a problem, that's we're kind of thinking about it if it's interfering with, important things in the child's life, like thinking about friendships, school, family life, or if it's causing the child or their family a lot of distress and emotional overwhelm, then we would think of it as a problem and would recommend some input from professionals.
And in terms of cause of anxiety, so what is it that actually means, one child might cope with something without too much fuss, but then the next one might experience, an unusual amount of worry that's, as you say, affecting them and their ability to get on with regular life?
I guess it's really complex, and there are a lot of different factors that play a role in terms of whether or not children do experience high levels of anxiety. So we do know that quite a big proportion of that is down to genes and genetics. So, we often do see that kids who have high levels of anxiety have parents or other members of their family who also experience anxiety. That's really common. And I guess, other things that are happening in their life. So if they've experienced, traumatic or stressful events, that can often contribute to and lead to anxiety as well. There's often lots of different things that we're looking at in a child's life to work out exactly what might be contributing or what might have caused the anxiety.
So a bit of a combination of genetics and environment,
definitely.
Lots of things.
Yeah.
So we've got some questions from some of our listeners that I think we'll get into a bit more detail about, different ways kids might experience anxiety. So we're going to go to our other Grace now, producer Grace, to read us the first question.
Perfect.
This first question today comes from Emily, and Emily wants to know, how can anxiety show up in kids? Is this just in their behaviour, or are there physical signs too?
Thanks, Grace. Great question. So yes, there are lots of different ways anxiety can show up, and I guess it's different for every child, and it might be different in different situations for different kids as well. What we see is a lot of the kids who experience anxiety report physical symptoms, so or like body clues that are associated with the anxiety. So some of the common ones we hear are like feeling nauseous, or that kind of sensation of butterflies in their tummy, that heart racing, pounding sensation. Other things like they might get really hot and sweaty. Their muscles might be really tense. They're some of the physical signs that we see. With anxiety, a lot of kids tend to avoid the situations that are making them feel worried or anxious. So they might stop wanting to go to school or stop wanting to go to other activities that, many of which they might have previously enjoyed doing. Lots of other ways anxiety can show up, reassurance seeking. So, constantly asking parents or other adults questions about what might happen and whether they're going to cope. We see, concentration difficulties, fatigue and tiredness, and sometimes, changes in terms of their eating and sleeping too. I think one thing that, surprises some parents is that anxiety can also show up as like frustration and irritability and anger too. And so what we sometimes find is that when we see kids who are experiencing, increased anger and frustration, what sometimes lies beneath the surface of that is actually a child who's just feeling completely overwhelmed by experiences of anxiety.
Lots of different ways, and it's not always obvious, is it, that anxiety is what's actually going on, particularly in younger children. Can you tell us a bit more about how those body clues actually happen? Why is it that anxiety can show up with physical signs and symptoms?
Some parents probably would have heard of that fight-flight system, and that's the system that's activated when we feel like we're in danger or in threat. And so it's designed that system is activated as a way designed to keep us safe. And to kind of mobilise the body to do the things it needs to do. And so with anxiety, that same thing happens. And so those physical symptoms or body clues are all related to that fight-flight response that is associated with anxiety.
And one thing I find that parents often say, so then is it all in their head? But it seems so real, it's physical.
Yes.
And in fact, it's both, right?
Yeah.
So it's the brain triggering off that very physical response that kids are really experiencing. The heart is racing.
Yes.
They do feel sick.
Yep.
It's just a matter of working out how you go back and address that anxiety underneath it, setting it all off.
Yeah, definitely. Yeah. So, as you say, their body and mind is perceiving danger, and that, sometimes that system goes off when it doesn't need to, or maybe it sounds too loudly when it doesn't need to sound. Like it needs to just be a quiet, alert to something going on. Those symptoms are very real for kids.
Absolutely.
Yeah.
Great. All right. So we might go to the next question.
Yeah, sure.
Thank you. Our next question today comes from Sophie. And Sophie wants to know, is anxiety more common in children who have ADHD or autism?
We do know that kids who are neurodiverse, so children who have autism and ADHD, do experience anxiety at higher rates than children without autism and ADHD. So for these kids, anxiety might present, when they're in new or unfamiliar situations, if they're separating from parents and caregivers, in response to sensory input or information, if there are sensory sensitivities that they experience. And also, I guess, in the context of going to school and social interactions too, because of the differences that they have in their learning and in the way that they communicate socially as well. For kids with autism and ADHD, we can often see that anxiety present as emotional dysregulation. When unexpected changes happen or when they're put in situations, I think when the expectations don't quite match what they're able to do or what their capacity is. So, it's definitely something that we do see and is more common for these kids.
I just want to pick up on something you just said there, Grace. Emotional dysregulation. What do you mean by that?
What I mean is that, when children do experience big emotions or big feelings, they have trouble managing those. So often we can see that in terms of like outbursts, so emotional outbursts, or sometimes in their behaviour as well.
That kind of idea of a meltdown, perhaps.
Yeah, definitely.
And in terms of thinking about that anxiety component as a particular aspect to look out for or manage, what sort of advice have you got there?
I think similarly to like looking out for the key kind of signs that I spoke about earlier. And you know, if your child is experiencing really big emotions and a lot of trouble, regulating those and becoming really easily overwhelmed, I think anxiety is something to look into and explore, and just, talking to the GP or a psychologist or another health professional is definitely recommended. Yeah.
Great advice.
Yeah.
Thanks, Grace. We'll hear the next question.
Our last question today comes from Bronwyn, and Bronwyn says, I've been told that there are a lot of developmentally appropriate anxieties that children eventually develop the skills to handle. What are the signs that the anxiety has escalated and needs clinical intervention?
Big question there from Bronwyn. So she talks about developmentally appropriate anxieties. Maybe we can talk a bit about what that means first.
Yeah, definitely. So I think there are some worries and anxieties that we see commonly in kids at different ages and stages. So I guess if we're thinking about a couple of examples, little babies and toddlers, we commonly see separation anxiety from parents, and we consider that to be really normal. And I
protective
guess,
even.
Protective, exactly. Yeah. And then I guess if we're, thinking about the older kids, maybe teenagers and adolescents, we often see a lot of worry about what other people think of them and how other people are going to judge them. And that's really common as well. So I guess often the worries change, the nature of the worries change as kids do get older, and often they can be quite normal. I guess it's just about at what level they are happening and how they're impacting on the child and family's life as well.
Okay, so if, for example, as Bronwyn's talking about, perhaps you're observing that your younger child or toddler or maybe preschooler is having some trouble separating, at what point do you decide this is no longer what we'd call typical or usual, but instead now it's becoming perhaps a bit of a problem and therefore we need to get some help?
So I think, if it's stopping your child and you from being able to do things that you need to or want to do, like, if they're no longer able to go to kinder, or, if they're a bit older and they're not able to go to school, or other activities that they want to be doing or that are important for them. That's one reason. And if, your child and the family more broadly are just feeling completely overwhelmed with how to kind of manage and navigate those worries, I think just speaking to someone can be really helpful and getting some practical tips. It doesn't always have to be a long-term, engagement with a psychologist or someone. And I guess the other reason that it might be helpful to speak to someone is if you're finding that it's hanging around for a while, like if it's there for a few days and then goes away, or there for a few weeks, maybe it's okay. But if it's hanging around for a while and is present most days, I think it would be helpful to reach out for some help.
Yeah, really great advice.
Yeah.
So now we're going to move on to another key, I guess, element of the podcast, and that is tackling a myth.
Yep.
So if you think about anxiety in particular in children and young people in your work, what is one of the most common myths or misunderstandings that you hear that you'd like to, set everyone straight about?
So I think, Anthea, one myth that, we commonly hear about is that, anxiety will just pass, and that, avoiding situations that we're feeling anxious about is really helpful and is going to help. That's, definitely one thing.
Yeah, so parents often think, oh, that's too stressful.
Yes.
I won't put them through it.
Yeah.
So what, in fact, is your advice? What does help?
When a child avoids a situation, they don't learn that they can, in fact, cope in that situation with the anxiety. And also it means that they're missing out on so many opportunities. So, if a child is, anxious about going to school and starts avoiding going to school, they're missing out on, learning and social interactions and friendships. And that can have huge impacts on their life and also on their mood as well. So, it's we kind of see and work with families often around, okay, the avoidance. what's it like in the short term, but then actually thinking about what does it mean for you in the long term? What are you missing out on that you want to be doing or that you want to be doing more of?
Yep. And I imagine a lot of parents perhaps listening who maybe can relate to this with their own child might be thinking, I get that, but it's easier said than done. So they're facing that birthday party or maybe, going along to the Auskick match that feels really overwhelming for their child, or showing up to kinder.
Yeah.
And things feel so big and those emotions are so overwhelming for everyone.
Yes.
That it feels like there's no way through.
Yes.
What's your advice there?
For parents, when their child is so distressed and anxious, that, of course, has a huge impact on them and how they're kind of feeling as well. So I think, gently encouraging and supporting your child to really gradually face those fears. So, often we suggest starting with something that is causing less anxiety and like building their confidence around that as they move toward trying out things that are feeling more challenging for them. So if I give you an example, for some kids, getting up and talking in front of the class and giving a speech is really anxiety provoking.
For some adults.
Oh, for everyone.
Yeah.
That's very true. So, we might be thinking about, okay, what are the gradual steps that, your child could attempt and could try out before they get to that big goal of speaking in front of the class. So it might be, practicing their speech in front of the mirror on their own as a first step. Or maybe they're just practicing their speech in front of one family member and then progressing to the whole family. It's going to look very different for every child, but kind of that very gradual approach so that they can build some confidence as they move toward the things that feel probably more daunting for them.
Absolutely.
Yeah.
And so that leads us really nicely into perhaps a bit more of a chat about how we treat or manage anxiety. So it absolutely is treatable.
Yes.
And as you say, sort of sitting back and thinking it'll all go away if we just ignore it or they're going to grow out of it, we know actually is much less effective than getting help. Mm-hmm. So as a psychologist, what is the sort of help that you can provide for kids with anxiety?
So I guess we'll always start with an assessment, so to better understand what the child and the family's experience of the anxiety is. And depending on that assessment, we will come up with a treatment plan. But often the kinds of things that we will be, supporting kids and families to do. So we usually, like to help kids understand their anxiety a little bit more. So it can be helpful for them to understand the purpose of anxiety and why it's actually showing up, so that it's not viewed so negatively. And it can be really helpful to work with the child and family to understand what their unique experience of anxiety is. So with that, we're kind of thinking like the internal experiences. So what does it feel like in their body? Those body clues. But also thinking about like what's going on in their mind. So what their mind's saying to them or what thoughts they're experiencing when the anxiety shows up. And then as well, we're interested in hearing from kids about, what does the anxiety want them to do? And often that's the avoidance, and that's when we can do some work with them around, is this helpful in the long term? And so we'll do some work usually around that, and then, work with kids to develop a bit of a toolkit to, with lots of different strategies that they can use when anxiety does show up. Things like breathing exercises, mindfulness. Sometimes kids find it helpful to have some like statements they can say to themselves when they're going into situations that might make them feel anxious. And I guess we'd be also supporting children and families with the approach that I spoke about before in terms of gradually facing their fears. So, building a bit of often call it like a step ladder or a hierarchy of their fears and slowly, building up and working toward the ultimate goal of what they want to be doing, but what the anxiety might be getting in the way of at the moment.
Absolutely.
Yeah.
So parents and children don't need to do this alone.
No.
what steps should people take to reach someone like you? How are you going to see a psychologist? Obviously, not everyone comes here to the hospital, but most people in the community can get some sort of support.
Yes.
What would be the first step? Where should parents go?
So the first step would be going to the family GP, organising. Often it needs to be an extended appointment to organise a mental health care plan, and that allows access to up to 10 subsidised sessions with a private psychologist every year. And often the GP is a good person to speak to, as they know the different psychologists in the local area as well. So they might be able to suggest some specific clinicians. Yeah.
Great. And sometimes I find schools are a good resource too. There might be a psychologist who's working with children at a particular school that you could also connect in with as another option.
Absolutely. Yes, definitely.
Great. And then sometimes in some situations we do use medication for anxiety. So as a paediatrician, that's something we will occasionally prescribe, obviously in combination with all the supports and therapy that you've just talked about from psychologists, and usually that would be older children and in the rarer cases. But there's certainly lots of different ways that we can treat and support children and young people and their families to navigate anxiety.
Definitely. Yeah.
Thanks so much for coming in today to chat, Grace. It's been really great to have you on the podcast, and we'll make sure that we put a link in the show notes to all the resources we have here at RCH for families to take a look at as well.
Thanks so much for having me, Anthea. I've really enjoyed it.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.